Hello everyone, I'm Dr. Baz. Welcome to the endometriosis journey. Sarah is here with us to talk about her journey. Sarah, welcome to the podcast.
Thank you so much for having me.
Thank you for sharing with us today.
Of course.
First of all, I would like to ask you one simple question to start our conversation. How was your life before your endometriosis diagnosis?
My life before I knew I had endometriosis was just consistent of pain. And I was always told that this pain was normal from a young age to where I started menstruating and I was bleeding through everything, having severe pain. I was always told that's a normal part of womanhood and I just had to suck it up and deal with it. And then as I got older, it got more and more debilitating. I got to a point where I had to drop out of school because the pain was so unbearable. I could barely get out of bed. I had to drop down in my job. I had to go on a leave of absence. Endometriosis for me before my surgery just equated to complete loss of my life.
Okay. Sorry about hearing this about these things, but I want to make sure that it's clear for our listeners. So, who diagnosed you? You have endometriosis, or you search that you think that you have endometriosis and seek an opinion from the doctors?
Well, the way that my endo journey went is my first gynecologist told me I was a liar. And she said that if I was in as much pain as I thought I was in, I wouldn't be able to drive to a doctor's appointment, let alone sit for an appointment. My second gynecologist misdiagnosed me for PCOS, even though there was no proof of PCOS. She said that's the only thing that could explain it. After that, I started looking for my own answers, and that's when I stumbled across endometriosis. My first doctor agreed with me and took me to surgery, but failed to remove as much as she could. And at that point, that's when I started seeking you out because I needed a doctor that would take my endometriosis seriously, understood how debilitating it was and that it wasn't just all in my head and I wasn't a liar, and somebody who would fight for me and fight to treat me as best as they could.
Okay, I understand. Very good description. So also, I want to make sure that the first surgery was done before you see me, right?
Yes.
So when was it done? Just give me some idea that, the diagnosis and then the doctor believe you that you have endometriosis and take care of you at the moment. But are you comfortable with the general gynecologist to operate you? I know that you are a nurse, you have a degree for nurse, and then you are trying to, pursue about the nurse practitioner. So for your standpoint that even if being a nurse, so you didn't get all the answers from the other doctors, and then they told you that it's in your head. The pain, you just take the pain, and then we cannot do anything about your pain. So how comfortable are you? The first surgery done by the general gynecologist, they are not specially trained by the endometriosis field.
So, like you'd mentioned, I've been a nurse now for going on 6 years. In my 6 years of working as a nurse, going through schooling, I never was taught about endometriosis. It wasn't until I looked it up myself that I found out what this disease was. And in that, I did not know that endometriosis specialists were a thing. I went in and my gynecologist just told me, this is the surgery we have to do. This is the only way we'll know. And I honestly did not know any better. I did not know that there was somebody above a standard gynecologist who knows this, breathes this, studies this, and this is all that they do. Because if that were the case, did my first surgery help me get that diagnosis? Absolutely. But I would have just went straight to you to try to not only just get that answer, but to get the surgery done properly and correctly the first time.
Excellent. I understand. I'm sorry about that. You have one surgery before me, but at least you educate yourself, you advocate yourself that, something's not right, even if the first surgery is done, but still you have experienced the pain. Mm-hmm. I'm assuming that things are push you to see endometriosis specialist. Is it correct?
Yes. So after my first surgery, or actually tracking back before the first surgery, the symptoms that I was experiencing constantly were right-sided pelvic pain. It felt like a softball was ready to explode. I was having rectal pain. I completely went amenorrheic. I lost my period on top of the other beautiful endo symptoms of the bloating, the gastrointolerance, all of that stuff. And my first surgery, it got rid of those symptoms for about 3 months. And then everything started slowly coming back. And that's when I said, you know what? Clearly, I'm looking in the wrong direction. I need to see if there's somebody that knows better than a standard gynecologist. And like I said, at the time, I did not know endometriosis specialists were a thing. And coming to you, that's when I realized that there are people out there that 100% care about this and want to treat not just the disease, but the patient. You were the first doctor that treated me like a patient rather than a nurse.
Yes, thank you very much. So definitely you are basically standing out good points. Number one, that what I'm always in my practice, I am always focusing on the patient's symptoms. So what their experience about the pain, it is usual that everybody knows that endometriosis is coming with the painful periods, painful sexual activities, any bowel problems and urinary frequencies. And these are the very complicated symptoms that you don't even understand what's the problem, where are the causes of the problem. So this sometimes takes 7 to 10 years, almost a decade to get diagnosis. Even if you have a nursing degree, still you don't have an idea what's going on with you.
Yeah.
So at this, and the previous doctor give you some diagnosis. This is also starting point, but the whole point about this podcast, our listeners, that I want to make sure to emphasize that these symptoms is not normal. The pain is not in your head. And then the pain, you cannot normalize your pain.
Yeah.
If you experience these things, sometimes you need to find out and be your own advocate. Thank you very much for sharing these things with us, first of all. So let's go deep diving about your endometriosis symptoms again. So after the first surgery, you mentioned that you still have some pain. After 3 months, your pain starting over and over again. So you came to me and I was, talking to you. It's a 1-hour consultation, examine a full body examination to make sure that we are not missing anything. After that, you decided to have a surgery done by me.
Yes.
So are you comfortable at that moment that you get all the knowledge, all the information, all the informed consent that you're ready for the second surgery? I know that it's being a nurse, being a patient, surgery is not always a good, it's a scary for everybody. But sometimes surgery is the best option.
Absolutely.
Am I thinking correctly?
Absolutely. And coming in to visit you, it was a completely different atmosphere than any other doctor's office I've been to. Like I said, I've been working as a nurse for 6 years. I've been around many doctors, been around many consultations, and it's very scary to go from the nurse that takes care of everybody else to being the patient looking for somebody to take care of you. And I went through multiple doctors telling me, no, it's not a gynecological problem. You need to see a gastroenterologist or a urologist. Nobody had answers from me, and it didn't seem like anybody seemed to care to find answers for me. It wasn't until I came to you that I felt like somebody didn't look at me just for my job title. A lot of other doctors looked at me and said, oh, you're a nurse. You already know what's going on. You know how this goes. When I don't. I've worked 6 years in cardiology. I know nothing about reproductive health. You were the first doctor to sit me down and say, yes, I know you're a nurse, but let me tell you everything that's going on, and made me feel safe as a patient. So leaving that appointment, I knew that, yes, surgery was the right thing to do, because you also caught things that my first surgeon totally missed. And I knew that surgery was the right route to go, but also I knew that I hit the lottery finding the doctor I did that respected me and my time and my profession and my experience to give me that attention that nobody else did.
Yes. Okay. Thank you. Thank you. I really appreciated what you're telling me about my practice, but it's all about again, as a patient, as a nurse. So I am not even thinking about your job title at that moment. I want to make sure that I will get all the information to you. I will provide all my knowledge. And then also one more thing I forgot to tell you that, because when you came the first time, you brought your original pictures before the first surgery. When I look at together, I said, that area at some point probably incomplete surgery, and this is causing the problem, and it's all the pelvic pain, all the symptoms. So we sit down 1 hour, and then all the drawing, all the schematic pictures. And then, you know what, Sarah, this is my proposal to you for the probably getting healing better and feeling better after my surgery. And then thank you so much for the also relying on me and then trusting on me. And then we did together the surgery. And the surgery probably happened last August, right?
It happened July 31st to be
Okay,
exact.
perfect. Yes, okay, one day, I'm sorry about it, just one day missing, but July 31st, okay, yesterday, almost like that, eight months after the surgery. And then tell me about how was your life right now after my surgery?
Even the moment I woke up from surgery, I felt different in the best way. After my first surgery, I couldn't really walk or do anything after a week. Meanwhile, after your surgery, I was up walking around in recovery, doing laps around that the nurses were chasing me around. But from the moment I woke up from that second surgery, I just knew something changed and I got my life back. I was not only able to go back to work and do even more and excel in my job in ways I never did, but I was able to go back to school, which was a big thing endometriosis held me back from. And I am just striving in ways that I never thought I would. I'm now more active than I've ever been. I'm striving to learn more and spread more awareness about this disease. I'm trying my best to be an advocate in this disease. And while doing that, I'm trying to also work on myself more because now I have the physical capability to do it. I can go work out, I can go run, I can go hike. I could do things I never was able to do before because I was always scared my endometriosis would hold me back.
Excellent. This is like a real things that I feel very comfortable and happier that the patient experience this kind of the lifestyle changes. I think this whole point about this surgery and then lifestyle modification also coming together. So what also I would like to discuss with you one more thing about after the surgery, you told me that you're immediately feeling some difference about the pain, which is I think the cause of the pain, the root of the disease is gone by me. I remove it. I have no problem about this one, but I want to make sure that after then for the recovery phase, that did you change in a diet or lifestyle modification that, I would like to also advise my listeners that endometriosis diet technically is like a Mediterranean diet or the anti-inflammatory diet. If you follow these diets on instruction or exercise, also another big part of the patient's life, I think it will definitely get better. I'm very happy and very honored that I operate you and also you are feeling better. And then also this is the area from my understanding that very lack of awareness and it's definitely getting aware and more. But I think we should more and push our boundaries about that. Endometriosis awareness is the most important part because we know that 1 in 10 women is struggling about this endometriosis and misdiagnosis, dismissed. And these things we need to put in our priority to get healed and then better for our community.
There's no reason that in the stage of medicine that we're in, that a disease that affects estimated 1 in 10 women, statistically they think it's even higher, that it takes an average of 10 years to diagnose. To me, that's absolutely barbaric in the stage of medicine that we're in, that a disease that we can see is so prevalent and so debilitating is taking this long just to get a diagnosis, just to be even recognized. And that's where I think doing things like this and sharing people's stories and even just you shedding the light on the realities of endometriosis, it's so important because people can sit and read an article or a newspaper clip all day, but hearing the real stories from the perspective of the patient, or just as the surgeon, that you've seen how people's lives went from rock bottom to they're able to reach the sky now, that's what people are looking for and that's what people are striving for.
All right. Yeah, definitely, you are 100% true. So this whole point about this conversation with you and me that make sure that we have more awareness about endometriosis. I see all the time dismissed and misdiagnosed for the other patients. I feel guilty about this patient. I will try to give my patient the best care for them, provide the best excellent solution for them, and everything's I think is going well as far as we shout out for all the endometriosis awareness. And then this is a real disease. Endometriosis is not in your brain or in your head. The pain is real. And then I will tell all my patients that the pain is the most important warning sign. If your body is telling that I have pain, and then this pain makes you be your own advocate, and don't trap the system that just get the birth control or other options that is cure the disease.
Yeah.
I think it's the best thing is that get a good educational, be your own advocate, get all the information, and then try to your best to see the best doctor if you think that you have endometriosis.
And I think that's an important thing for patients to know, because I know how scary it is to be a patient and to have somebody who is a doctor who, you're in a vulnerable position. The doctor really is the one that has the authority and is calling the shots. And at the end of the day, many people need to know that for every doctor that will close that door and say no to you, there is another one who will take care of you. Just because one doctor says, even for me, my first gynecologist, I don't believe you. I think you're lying. The pain is not as bad as you say it is. For her telling me no, I have you saying, yes, that makes sense. Pain is not a normal thing. Let's look into it. So I think patients need to not give up on themselves and realize that, yes, the doctor is the one that is taking care of you, and it is vulnerable to be a patient. But at the end of the day, you are your own boss. You have the right to say, you know what? I don't think you're giving me the care that I want. I'm going to somebody who will.
Yes, you're right. Definitely. Thank you, Sarah.
Of course.
Appreciate it. You're on the podcast.
Thank you so
Thank
much
you
for
sharing
having
your
me.
journey. And I'm sure that our listeners appreciated hearing from your experience about your endometriosis, and you're helping them to make the best choices for their endometriosis treatments.
We've all got to stick together when it comes to this. It's 1 in 10, but at the end of the day, it's all of us fighting together for the same thing.
Yes, we fight endometriosis together.
Exactly.
Thank you, Sarah.
Thank
Appreciate
you.
it. Thank you.
Of course.